And we need to exercise good judgment in that.
Yes. And I'm saying that I would. Oh, me. And the. Yes.
Oh, wow.
Our county ordered 200 bags.
I just saw that,
And the state is.
but I kind of already figured she was.
Oh, yeah, she told me
What
she's.
is the cost
Yeah,
of
cost.
Yeah.
200?
For COVID vaccine.
You know that it's not prepared.
Right.
What about? Some of them said that they wouldn't take it up there.
That's interesting.
Yeah.
So there was like two things.
They'll get it. You don't pay on Medicaid. I don't know.
Right.
What are we?
Right.
Maybe they don't wait.
Nutrition, like, I want to be at the rest. Like, what's it with it?
We didn't realize why some cause of death in the United States.
This one is signed off, and they said you won't recognize it. You should have taxed them. I remember it comes.
It's for you. Charge someone alone. Yeah.
These days. Thanks. We're excited.
All right, we'll get started. I know we got several people that have joined online also. So we'll just jump right into the agenda here and thank y'all for being here today and appreciate you being part of the Safer Schools Task Force. We're going to try to keep the agenda online here, keep it up to speed so that we're get through by the noon deadline. So I'm going to hand it directly over to Karen to give your update on the Safer Schools.
Okay, well, do I need a clicker or?
I have to do it.
Okay, so I must sit here if everybody's okay with it or, and do it. So definitely the, just want to point out for the new people, that the last bullet, our focus, the Center for Safer Schools focus is on school climate, school discipline and emergency preparedness concern. And so it is our legislative mandate to ensure that schools have the training, the resources, and the technical assistance that they need in order to do that. No problem. All right, you can go ahead. So I want to just talk about what's new in 2023-24 school year. House Bill 605. It is something that we have been working with the General Assembly, in particular Representative Corbett, for a couple of years. And what we'll do is that will provide for threat assessment teams to be developed and mandatory in a consistent way throughout their schools, and then also for them to report back to the center. And so the center has been charged with providing that guidance on how those threat assessment teams will be developed and utilized. We, the center, have already began training schools as far back as February 2022, I think, was our first training in threat assessment team development. So we are ahead of the game as far as training. This year, we will take the remainder of the time to train as many schools as possible who would like the training. We, the center, have a December 31st deadline to provide that guidance to the schools, and then they have a March deadline to have a plan in place. And so we are definitely excited that we will have that consistency, and the threat assessment is to assure that children, students who may be at harm to themselves or others, get the needed help. Get that help that they need, get that help to prevent their situation from escalating. And so we want to make sure that it is done with fidelity, is done consistently, and that the center will help the districts providing that technical assistance so that they can do it in a manner that is beneficial to all parties. The 605 also includes the threat assessment. The peer-to-peer students and group, and we will help and along with the guidance counselors to shape how that will look. All of this will start next school year. So this school year is a planning and preparation year where we will be looking for help and guidance to support the districts in this effort. And so we will start the monthly sessions again, starting in October with the training that I mentioned early. They're 8-hour sessions, they're virtual, and they are free of no cost to the school personnel. It is our intent to have them regionally in person at least one time. And we have not decided how that's going to look, but that is the intent. We're working with our partners, the trainers, to develop a calendar to assist districts who would prefer to do the training in person. We have selected our parent engagement committee. We will have our first meeting on next month. These are 24 parents of children K through 12. For each region, DPI breaks up the state in 8 school regions. And so each region will have 3 parents. 2 of the parents will be from a traditional school and 1 parent will be from a charter school. And we're looking forward to that. We have merged this parent engagement committee with the Superintendent Truitt PAC, her parent advisory committee. And so we have taken the people who have been diligent and working on safety off of her advisory committee, and we have engaged them with ours so that it is like really seamless. It is parents working together, parents helping us to identify the needs for their respective communities. Another responsibility of the Center for Safer Schools is the consolidated data report, where we talk about discipline data, we talk about alternative learning programs, and we also talk about dropout data. And so all of that data is come into the center through PowerSchool, and we make a presentation yearly to the State Board of Education, and then that is forwarded over to the General Assembly, the Education, the JLOC, so that they are able to support the center and to support us in providing the necessities that we would need to address some of the concerns. And so that has been and will be always something that we need to discuss, especially as it relates to disproportionality. So that is always a question with regards to race and gender and what it looks like for children of color as it relates to discipline, whether it be in school suspension, short, long-term, or expulsion. So we have received, the center works with our data person, and we have received quite a few inquiries, concerns as it relates from school districts about behavior codes that we've not necessarily had. And a lot of times we understand that laws sometimes with technology doesn't keep up with trending things. And so we have developed new behavior codes that were put out in our discipline data manual this year. And this is just some of them to let you know what kind of things we are seeing as it relates to school safety. These are things that once we start getting repeat issues related to this, then we start to look, do we need a code? If it's starting, because you can only use the other code so much and it be effective. And because then we want to start tracking the data and tracking specifically what's going on. So these are some of the data codes behavior codes that we have. And that's just additional. And as you see, vaping is becoming or has become a great source of concern. And so we definitely are seeing more of that as it relates to behavior code reporting. That's right. One of the things that I have been trying to do since being in the one of the things that I've been trying to do since being the director of the center is bring us to a point in the state where we are as consistent as we can be in our vocabulary when there's an incident. A lot of times we will hear lockdown, and parents in a particular community will as they should, panic or get really concerned, where sometimes it's not because an intruder is in the building. It is because something is happening in the community. And for the safety of the children, it is necessary to lock down the school. And so what we're trying to do, we're working with I Love You Guys, which is a nonprofit, to help us identify wording that is consistent throughout the state. And so that when you hear certain words, say 146 is hold versus meaning, everyone stays in place. There's no traveling between out of the building. And it doesn't necessarily mean there's something happening in the building. It just could be something's happening in the community and they want the students to stay where they are. So we're looking to create action codes that's similar to I Love You Guys, because a lot of districts already utilize I Love You Guys. And so the state, through the center, is in the last stages, I hope, of securing our contract with I Love You Guys so that it will be something that we will train all the districts to utilize. Everything the center does is definitely up to the discretion of the individual PSU, either the traditional district or the charter school. So some continuing initiatives. We had our RISE Back to School Safety Summit in Gaston County this year. We were really pleased. We had over the 3-day span, over 300 participants, school personnel of various degrees, administrators, teachers, transportation, counselors, social workers, coming together to hear different topics as it relates to school safety. We had representatives, we had a couple of senators to come, and local support from the local school board, local sheriff, local police chief to help us with that initiative, and we're really grateful about that. And that's just, and we, Secretary Buffalo was in attendance as well, and we were really grateful for that, but that's just some of the updates. One of the things that I started doing as the executive director is going out to the schools. So I asked the schools at the beginning of the school, schools would like for me to tour their schools, have a conversation with them about their concerns and challenges as it relates to safety. I don't think you can do this work just from the desk in Raleigh. I think you have to go out and you have to talk to the districts, because the districts in the West have different concerns from the districts in the East. And I want to respect those particular districts and hear from them what their challenges are, right? Because we have a legislative mandate to provide technical assistance, training, and resources. You can't do that if you don't know what in particular that they need. And so we are continuing to do that this year as well. EKG2, I think the last time we were here, it was supposed to be in, or maybe not, the budget. It was not, but we are still going to do it. We are doing it at the 7th grade level. The monies that we thought we may get included in the budget was going to allow us to expand to the 9th grade level. We are finishing up the pilot. The middle district has completed theirs. I think most of the Eastern district have done theirs. We're still talking with the West on them identifying their districts. It is up to the, and we're working with the U.S. Attorney's Office in all three districts, but it is up to them to make the decision on who they want to include in the pilot. And just so you know, the EKG2 is 7th grade curriculum. It does meet the health standards, and there is a movie, a 28-minute movie that goes with it, and we have heard nothing but positive feedback from the young people. The anonymous reporting, I cannot say enough about that. That has been a tremendous asset in us identifying issues, identifying children who may be a harm to themselves or others as it relates to just having that trusted adult to talk to. That's the whole premise of the anonymous reporting system. Our goal is for that child to identify an adult in their school or district that they can talk to. However, if that does not materialize, then the crisis center that is part of the anonymous reporting system through Sandy Hook Promise is there 24/7, 365. And as the director, I get the life tips to come in, and I can't tell you how confident I feel when I see the real-time interaction of young people, 11, 12 years old, interacting with the crisis center who want to take their own lives. They're 11 and 12 years old, and they have gotten to a place where they feel that they would be best to not be here. and to see the professionalism, the care, and the compassion in real time through the app, it is just so reassuring. As a mother and a grandmother, I cannot imagine my child or grandchild walking that journey without some support. So we are definitely appreciative of that. We July 1 through September 15th, last Friday, we've had over 1,200 tips already from July 1 till now. And so those are, go back, please. That's all right. Those are the top 5. Bullying, cyberbullying, ever since this app started in November 2019, and at that time, Bo Trumbo, who is here, was the person who implemented this. Ever since that time, bullying and cyberbullying has been number 1. I can't remember a time when it was not number 1. And so definitely we need to look at how to address that. And as you can see, suicide and suicide ideation is high on that list as well. And so since the inception of the app in 2019, November, we have had over 25,000 tips. And so that's quite a few. This is even during COVID. COVID tips went down in volume, but the seriousness of them did not, because now children were at home and they had other challenges, and they didn't have that trusted adult in school because they were not in school. So I'm really appreciative that we had this system in place. The panic alarm, and working with Assistant Director Bo Trumbo and Emergency Management, the center, are doing what we can to ensure that districts understand that this is something that is free for them to use. They opt in. I'm getting nothing but positive from a lot of districts who have opted in. Of course, there are some districts that will not be able to opt in because they may have other contractual obligations, or they just have another preference, but it is there for them. It is there at no cost to the districts. And so we're very supportive of that. Partnership has been very positive. And of course, grant funding. The center, every year I ask for grant funding. Our SRO funding is recurring, so we get that every year. But the other areas, the safety equipment, student in crisis services, and training to increase school safety is determined by the legislation, and the amount is determined. And so we made the budget. And we have for the last few years, and I'm really, really grateful to the General Assembly. They really, really take school safety serious. What I would like to end with, I think that's the next one is just me, yes. What I would like to end with is I want to talk about what the center needs. At this particular point, this task force is the task force for the Center for Safer Schools. And I'm not real sure what the update is going to be on as it relates to the school action plan. But here's what I know. I know that the center needs to be focused on the legislative requirements in Senate Bill 105 and House Bill 605. I also know that in my tours that I attend, that districts are telling me what they need. So I am getting the specifics on what districts need. And again, I'm hard pressed to think that with regards to school safety, whether it's safety equipment, whatever it is, that we can just sit in Raleigh and not go out and hear what they have to say. And so at this particular time, I was going to meet with Chairman Lassiter. We had set up to meet, and of course, I had a major schedule conflict. But I want the task force to look at supporting that the center are required to do legislatively, and what the districts are saying they need. And again, I don't know the update on the state action plan, but at this point, we're past the plan and we're into another school year. And I don't want us to miss the opportunity to do the things that we need to do as the task force for safer schools. And so that is to address the actual issues that the districts have, that parents with the parent engagement, and what the discipline data is showing. I mean, the data is showing what it's showing. And so we definitely need to look at that as a task force and address those issues. And, I know that there's always, political things that go on, but I have confidence that this task force wants to do what's right. And at this point, what's right is to look at the data and address the actual issues that are coming up. I welcome any of you to come with me to a school tour and talk with it. It is my intent when I go to these tours to talk to an administrator, to talk to whoever their safety person is, and then I ask to talk to the children. And guess who tells me everything, right? Yeah, I mean, sometimes to the chagrin of the administrator, I'm not asking questions, so I'm not there probing or investigating, but children, my husband and I, we have 8 daughters, we have 12 grandchildren. The little grandchildren tell us everything that go on their parents' house, right? And so we don't ask, but we listen too. But my point is that these children know what's going on in their particular schools. And so I'm anxious to hear what the state action plan has evolved in, but I would really want you to keep an open mind that the need of this task force is to support those legislative initiatives that through the data, we see are concerns for the district and the charters. That's it. I think, yeah, that's it. Okay.
Thanks, Karen. Appreciate it. Any questions for Karen?
I did have one question.
Yes, ma'am.
Hello, everyone. Eugenia Floyd. You mentioned that I love the idea of making sure for the coding with the common language. I really appreciate that as a district employee. My question was also when you said I love you guys as a contributor and help in the language as well as those different hold and secure. Mm-hmm. Does that organization also have supports in place for communication after the fact or during, if a school does go into hold and or secure? What I mean by that is also, do they support with communication, but do they also have it possibly made sure it's translated for all of our families to have access when incidents or anything is occurring within our community that is affecting the school building?
Yes, ma'am, that does make sense. And so one of the things that I didn't mention, I am still in the process of trying to secure those 8 school safety specialists. The market is a little more challenging, right? Than we anticipated, because we want good people, right? And so again, DPI breaks up the school districts in 8. So there will be a school safety specialist in each region. The intent is to have them train the trainer model so that they will provide that assistance in their respective regions. We are looking to have some of the documentation translated at least to Spanish.
Yes.
I don't I don't know if we have the bandwidth to do any additional languages at this time. But definitely we want it to be translated to Spanish so that we can have some help in that particular area. So yes, so when it comes to that region, and I felt like it was important to have a school specialist in the region because as I traveled around the district, those regions know what they need, and their region in the south west looks different from the northeast. And so that person who is the school safety specialist will reside in that region. And so, yes, they will help with that language. They will help with the technical assistance. Once I Love You Guys is the vendor.
Right.
And so once they walk off into the sunset and get the last check, then the specialist will step in and they will support the districts.
I just wanted to lift that up in the sense of like, as we think about our communications with families, like being really mindful of like, what families are we missing? What families are we possibly not considering, like who need to have access around the safety in that space as well?
Yeah, and hopefully, the parent engagement, when we meet next month, hopefully that parent engagement group will help us. The whole purpose of them is to help us communicate with parents in their region. And they'll know what that looks like. And hopefully with 3 of them in the region, we can get as much communication out as possible.
Thank you.
Yes, ma'am.
And I think I Love You Guys was started by one of the victims in Columbine, one of her.
That's
parents,
correct. I think the young lady, that was the last thing she said, I love you guys, to her parents. Yeah.
I do have a question. India Williams here. You mentioned about the Rave panic alarm and it being free and optional, of course. But I just have a question about, it sounds like there's some components that may require either some type of software or hardware. Is that part of the free approach, or is there some type of outfitting that would have to take place in order for them to participate fully in the Rave program?
I think that's something that Brave would be best answered as far as I am technologically challenged. But however, from what I understand, the majority of the districts will be okay. I mean, there may be some outliners, and I am in the attempt to hire a grant administrator, someone to help seek fundings for things like that falls out. But for the most part, I think they'll be fine. Listen, I went to DPI and DPI has embraced it. We have the panic alarm in DPI because my contention is I can't go out and tell the schools, hey, I want you to sign up for this, and we don't have it. And so DPI has it in its building. I think we rolled it out a couple months ago. And because we understand, and I even had it extended to the garage where the staff is, because again, it is for incidents. So what I would ask you to do is to go on that link, and his name is Matt, and to talk to him because they would have a little more insight on specific districts if there's a challenge with the infrastructure of the technology.
Perfect, thank you.
Unless, you had anything.
Yeah, not aware of any special infrastructure for the user. There is anomalies associated with the public safety answering points or 911 centers that can have upgrades that go into the mapping, geolocating of the alarm and so forth, but it should not be, not so much based on the user at the school level.
Got it, thank you. And one final question. I love the fact that you're going into the schools and being present. Would love to accompany you on one of those tours. So if you have a schedule that you could share with us of when it's available for us to tag along.
So if you will email CFSS, Center for Safer Schools at dpi.nc.gov, and just let my staff know that that's your interest.
Sure.
Okay?
Yeah, I had a comment on
Yes, sir.
slide 21, which talking about grant funding.
Yes, sir.
And I think three of the categories, school resource officer, school safety equipment, and training to increase school safety, there has been good legislative support. As you know, the state board has asked for every year for the last many years to the ratios more into line on social workers, counselors, nurses, and others for students in crisis. And we, in fact, some of your other numbers from the say something numbers show we have a large number and a larger number of students in crisis. We have not really made good inroads on getting support for providing the services we need for our students in those areas. And that is a great ongoing concern. I know that's less under your direction, but it's very much, a point of emphasis for the districts. And I say it only because I don't want to create a misleading impression in terms of the needs that we have for our students that we still very much need funded. And I would particularly lift up social workers, which are not funded at a particularly high level. They're the most data ratio of any of our workers. And if we are willing, if we will fund master's degrees, people with master's degrees in social services can provide therapeutic services, which we really need. Our school psychologists, and this is an understandable misunderstanding, primarily serve our exceptional children needs, as opposed to, I think a lot of people think a school psychologist is serving needs of students for some of these issues that we're dealing with, but that's not really what their primary function is. So I think it is important as we go through this that we lift up in every way we know how the needs of our students for these support services.
Yes, I 100% agree. That particular category gets the least amount of request for us in the safety grant. So the school resource officer is set aside. That can only be used for that. No changing. The other three, for the last couple of years, the legislators have given the discretion to the center based on the need or based on the request. And so our highest request in those are school safety equipment and the training. We don't get a high request in services for student crisis, but whatever
the
we.
legislature does from this.
Yes,
the
yes.
budget request outside. I understand your unique budget is different, but I don't want there to be any misleading thought.
No,
that we're getting all the funding that necessarily is needed for these important areas to support our students. That was the clarification I was
Yes,
trying to
sir.
make.
Yes, and let me say this, I could need more money on every area, so every area needs to be lifted, but I definitely agree 100%, Chairman Duncan, Vice Chairman Duncan, that we do need that, and we do support anything as it relates to the mental health. I just told you about the children who are 11 and 12 years old who are thinking about harming themselves, the threat assessment. So we are definitely looking to do that. And I even am looking to create a mental health unit within the center that's focused on safety, that doesn't do the other jobs, but just focused on the safety, in particular, the threat assessment piece. So that's what we're definitely looking for, federal funding to do that. So yes, sir, I did not mean to reply that we.
I didn't think you did, but I thought it was important to also
Yes, sir.
clarify where the needs are.
Yes, sir.
And I think that's even in addition to the fact that there's a new code of threat of harm to self and
Yes.
suicide, like, so it's definitely lifted up in that space as well, of like
Yes.
knowing that there are the new codes. Can you also remind us, and maybe everyone knows but me, where do the codes live as districts and or schools track or make the code? Where does that come?
So in, what you mean in Power School?
Is that where?
Yeah, so when they're doing they're doing the identifying of the
Yes.
incident, then those are the codes. And then we have a manual on our website that will give you all of the codes and the descriptions, with a discipline data manual and a discipline data reporting manual that's on there, that's updated every year. So we already put up the 23-24, the year we're in.
Does it also offer suggested interventions?
So we did bring to the state board last year some suggestions. But the center, doesn't, we have to be careful because our thing is training, technical assistance.
Absolutely.
Yeah.
And if you even have the equipment to even offer an intervention.
That's
So,
correct, that's correct. So where we would like to see is we don't mind, when they ask for that monies for that, to have innovative ideas on how to address with
Right,
those
okay.
interventions, where that could be that student, services for student crisis one. So we, I try to, we don't tell districts what they have to do, but we try to give them suggestions
absolutely.
on some interventions and saying, hey, that's what we did at Rise. Hey, this year we had sponsors at Rise and they had services. We don't endorse them, but just gives districts the thought process of, oh, I never thought about I could utilize this and do it with this funding. Yes.
Thank you.
And Dr. Farrell, I love what Vice Chairman Duncan was saying.
Mhm.
You know, when you have the school psychologists at the schools, they might service 4 schools.
Mhm.
And you got a student in need, if you had a school social worker, counselor, whatever, they can reach them more readily. Now, they can't do what they do, but when you have a child to have to sit, for months, if you're waiting on a school psychologist, and then sometimes there's a list of who those psychologists are to see first, and, it depends upon who's putting these kids on the list, how high are they in the at-risk category, or
Yeah.
do you just think they need to be up to see that psychologist because you're thinking in terms of medication, when you've got other things like suicide and other things that's affecting these kids that if we were at a school, master's level, we're more qualified than most people think, because for a long time, for 32 years, all I've ever heard was school attendance. But you're dealing with suicide, mental health, all types of things that master's level school social workers can do. And I think it's time that they change what they're giving us to do and make us look like the qualified people we are.
And I've heard that in different meetings,
Answering the telephone and
Uh-huh.
going in the cafeteria, there's some other things that we can be doing. And it depends upon what a principal assigns you to do. And it's not the school social worker not wanting to do more higher level things. It's, you don't have a teacher that's in and there's a sub out. So can you go down to this classroom? That's not school social work, And so I think if they utilize us, with our professional skills, you can help a lot more kids.
Well, thank y'all for the good questions and comments, and I know Yvonne is my go-to social worker when I want to know what's going on with social workers in the state. That's the woman right there. She told me about a kid she saved yesterday, so she's an amazing woman and has done amazing work with young people across the state. So thank you for your service in that role. It's such an important role. All right, I'm going to do my quick update, and then we'll take questions about that also. And so, just to give you an update on what's going on with the Department of Public Safety as far as school safety initiatives, and this task force, as Karen was describing, is a advisory board to her Center for Safer Schools, but also to the General Assembly and to the governor on school safety initiatives that need to happen across the state. And so I just want to highlight a couple of ones that are going on that we're working on in the Department of Public Safety. And a number of these are based off of things that we have seen as far as incidents that are occurring across our state. So we are doing active shooter training with law enforcement agencies across our state, especially with the agencies that are within the Department of Public Safety, but also through the San Rafael Training Academy. We're providing that active shooter training for law enforcement agencies across the state. Programming for youth that have threatening behavior. You heard Karen talk about the threat assessment legislation that was just passed. We also had the beta team that we saw the presentation from them last month from the State Bureau of Investigation that provides that. And so they do an outstanding job of helping us identify cases across the state when schools call or law enforcement agencies call to ask for support. those beta teams go out and actually do those assessments in school districts, along with the threat assessments teams that school districts have themselves. Gun violence prevention strategies that are, we want to invest in gun violence strategies that are working across the state. And so we've seen the intervention teams that will go in and work with kids or adults that have been shot in the hospital to have those conversations with them about how do we stop the retaliation that often comes after one shooting occurs in a community. How do we stop that from becoming multiple injuries in a community or multiple deaths in a community by going in and having those interventions? And we're working with social workers to actually have those conversations with those folks while they're in the hospital. Because a lot of them are reluctant to talk to law enforcement. And so we're trying to figure out who are the people that they're willing to talk to so that we can start getting that information. That's just one of the strategies that we're looking at, but also looking at other ways to really get involved in this gun violence issue, because that is a growing concern that we're seeing across the state. And one of those areas that we're working on with that is the NC Safe campaign. You see the logo that's up there. We talked about that last time, and the PSAs. We're trying to work with school districts across the state when they're having PTA meetings. Let's talk about it. I know for some people talking about guns is a controversial issue, but at the same time, the reality is that we're seeing guns come onto our school campuses. And if we want to stop guns from coming onto our school campuses, we got to have parents step up and be responsible to keep those guns out of their kids' hands, and so they don't get into their kids' book bag and bring them to school. On the first day of school in the state of North Carolina, we had 4 guns taken off of kids on the very first day of school. And every single one of those came from a parent that did not lock up their firearm effectively. And so we need to have this conversation in PTA meetings. And I know sometimes the PTA is not where the parents that we need to be talking to are going to be. And so we got to figure out how do we get out into the community and have that discussion with the parents that need to hear that message about it's important that you take responsibility for your firearm and make sure that does not end up on a school campus. It terrorizes the whole community. The kids, the teachers, the administration, the community that surrounds it, and the parents themselves, because I know I've gotten 2 lockdown calls today. This year already from my kids' schools. And so it is a panic moment when you get those calls because you're not quite sure what's going on. And I'm in the know. And I can imagine for parents that are not in the know. And I think that's why the codes that you talked about earlier, Karen, are so very important. The gang intervention training, you heard Karen talk about EKG2. We're also looking at other initiatives to work with kids that have gotten gang involved. We know that a lot of the guns that juveniles are picking up now are part of gang initiations, that they are stealing those firearms from vehicles that are unlocked. So we went back and looked at the incidents last year of how kids got guns that brought them onto school campuses. Of those, about 50% came from their own home, and the other 50% were typically stolen. When we looked at the places that they were stolen from motor vehicles. And in 60% of the cases, those vehicles were not even locked, right? We're trying to emphasize that people, first of all, a car is not a gun safe. And especially if you don't lock up the gun inside the car, it's definitely not a gun safe. And so we know that a lot of these gangs are using kids for initiations by asking them to go out and steal those weapons and try to bring them on campuses. Supporting the school justice partnerships. School justice partnerships, you guys probably are very familiar with, but that is the partnership between law enforcement, our district attorneys, our judges, our law enforcement in a community that really tries to determine what are those things that are school discipline problems and what are those things that are criminal justice problems. And because what we know is that if we send every kid to the criminal justice system that has just simply broken a school rule, we're overloading the criminal justice system with things that are low-risk problems that could be solved in a much more effective way. As Judge Corpening always used to put it, when you're a parent at home and your child does something wrong, it's a conversation that you have with them. In 30 days, we'll have a conversation about this, or do y'all sit down and talk about it right then? And so if we really want to change those behaviors, we got to look at what are the most effective disciplinary techniques that are going to work to change that behavior. And when I talk about disciplinary techniques, it may be services for a child. What are the things that child needs to be successful so those behaviors don't continue to occur in the school campus? And then we're going to continue with our school safety checks. Our law enforcement agencies that are part of the Department of Public Safety are Highway Patrol, ALE, and Adult Correction as far as their state employees with the probation and parole are all doing school safety checks at schools. They're going in, they're talking with the kids, they're checking on the schools to make sure everything is safe. We've done thousands of those in the last year. At last count, 3,600 of those have occurred in just the last few months of law enforcement just going in and checking in at those law enforcement at those schools and making sure that the environment's safe and checking in with the kids. A lot of times I'll sit down and have lunch with them. It's a good way to also kind of build a mentoring relationship between law enforcement and kids that often have not seen law enforcement in a positive way. So this is a slide that we did the National Night Out events right before school got started. We did this with law enforcement and community organizations across the state of North Carolina. I know our staff from juvenile justice attended over 45 of these different National Night Out events. And one of our big messages was the safe and effective storage of firearms with the parents that came along. We gave out 25,000 gun locks during those National Night Out events to really try to get that message across. But it wasn't just about that. It was also having conversations with young people about how do you make your school and your community a safer place. And so this is some pictures from the event that we had in Halifax County. And again, we're trying to do these all across the state and have these conversations as part of the NC Safe campaign, but also just how do we have those conversations with parents about that effective storage of those firearms. Next one. So we're doing a lot of crime prevention work across the state of North Carolina. In March, the governor introduced the Office of Violence Prevention. We're really excited to say that we've hired the new executive director of that. His name is Gerard Tate. He's the executive director. He's a ex-law enforcement, served in Iraq, and then worked in Chicago for a while, and worked in some law enforcement agencies in DC and Atlanta, and then really got interested in how do we prevent people from entering the criminal justice system to begin with. So he went back to school and got a degree in social work, and worked for many years on trying to do prevention work, worked with the Shot Spotter initiative that's out there, but looking at that data for Shot Spotter, which is looking at where gunshots are fired in a community, and asking what interventions can we put in those communities where we're seeing these high numbers of gun incidents occurring, instead of just saying how do we just punish people for those incidents, how do we actually provide services that are needed in those communities. So we're really excited about the Office of Violence Prevention coming on board. He's trying to hire a deputy director, and how this is going to work is that the director is in the Department of Public Safety, the deputy director will be in the Department of Health and Human Services. And so we're trying to partner together to say, yes, this needs to be at least a two-pronged approach of the criminal justice side, but also looking at the health and human services side and the mental health services that need to be provided. We're doing ALE, our alcohol law enforcement agency. It's doing joint enforcement operations across the state to really work on trying to get make sure that kids don't have access to alcohol and drugs in their communities. These are operations that are going into convenience stores and making sure that kids are not getting sold drugs or alcohol in those stores. And so we're really working with them right now to kind of make that presence known at the beginning of the school year to try to keep those vapes out of our kids' hands. That is a big problem that we're seeing. I know at my kids' school, they've had 8 fire drills already this year, and that's because the kids are vaping in the school. And so we've got to figure out how do we keep those vapes out of our kids' hands also, because that is obviously disrupting the educational environment on that school campus. As we're talking about the things that ALE are doing, I just want to mark that Matt Knight, who served on this committee for many years, passed away about a month ago. Matt Knight, for those of you that don't know him, was just a passionate and compassionate leader in this area, and worked really hard, did a lot of seminars and symposiums in schools all across the state of North Carolina about the importance of not doing drugs for our young people. And so I just wanted to lift him up for a moment. He served on this committee, I think since 2012. And so for 11 years, worked on the task force for safer schools, and just want to raise him up for all the work he did. One of the other things that ALE is doing is the NIBIN program, which is basically it helps us identify a gun that's used in a criminal act if it's been used in other criminal acts. And so we're going back and test firing a lot of the firearms that are now in evidence lockers across the state of North Carolina to see if we can track down if that gun was used in another incident somewhere else by doing the NIBIN program. It puts it in the national database and shows that those forensic evidence that's produced by firing that firearm was tied to any other incident in the state or in the country. ALE is doing the parent education program also on underage drinking and drug use. We've got the school panic alarms that Karen talked about earlier. There is additional funding in the budget this year to maintain that program and push it forward. And so we're excited about that. And I know that we've got quite a few school districts that are signed on, and I know you guys are working with emergency management to really make sure that we can get those other school districts that need it to sign on, and those that already have a vendor, they're welcome to keep it. But we want to make sure that everybody's covered. That's the purpose of the panic alarms. The State Highway Patrol is also doing our human trafficking awareness trainings across the state right now. We have seen human trafficking become a bigger issue. But raising awareness among our school personnel, especially our social workers and other people that may notice that a kid has been trafficked. This is a real issue, folks. Again, my wife works in an elementary school. They got a kid just about 2 weeks ago that it appears that kid was trafficked into our area. And so as young, this kid was 8 years old and had been abused and wasn't quite sure how the kid got into the jurisdiction. A grandmother tried to bring her into school, but it wasn't clear if that was truly actually her grandmother. And so this is an issue that we want our school personnel to be aware of and recognize when it comes into their school campuses. Implementation of transitional services for our kids that are leaving residential placements. How do we get them back into a school? We have lots of kids that go into psychological residential treatment facilities. We have kids that go into foster care. How do we get them back into a secure school setting? Because we know the number one protective factor for kids is going to school. And so by excluding kids, often we are tearing down the protective factors that they have. We want to maintain school safety for all kids on that school campus, make sure that the school campus is safe for all kids. At the same time, making sure that those kids that need those more intensive services have a way to access them. Increased youth leadership programs and family engagement support opportunities across the state. So we're working with our law enforcement agencies to host things like the scouting troops or scout guide groups in their communities to help build youth leadership opportunities for kids in our communities. Next slide. We've got tailored services that we're looking at, and I won't go through all of these because I want to make sure we stay on time on our agenda, but there are definitely some gaps in our services as far as mental health and foster care. If you are familiar with what's going on in DSS right now, there are lots of kids that are sleeping in DSS offices. All right. What does that mean? That's a kid that was taken out of the guardianship of their parents because the parents were not fulfilling their job as a parent. And then they're brought into DSS custody, and the community has not found a foster care placement for that child. So think about that. You're a child that's been taken from your parents. So you're thinking, my parents don't love me. And then you go into a DSS system where the kids also are seeing that they can't find a placement for that kid. That just sends another message that there's nobody out there that's trying to help me. And so we've got to figure out how do we fill those gaps across the system. Unfortunately, many of our folks in DSS are turning to juvenile justice and saying, do y'all have placements for these kids? And we have placements, but they're not the most appropriate placement for that child. So we've got to figure out how do we fill some of those gaps because these kids come back into our schools and they don't have the skills or the services or the simple thing of love and compassion that they need to be successful. Next slide. So as far as the juvenile justice data, I just wanted to show you that the numbers continue to uptick as far as juvenile justice data across the state of North Carolina. And so you can see the trend line over the last 5 years here. We did do raise the age in the state of North Carolina, which contributes to some of that uptick, obviously, in the number of complaints that are coming into the system. Next slide. This is the projection moving forward for this upcoming year, that invisible block I say over there, in comparison, you can compare it to the 2 years before as far as the number of statewide complaints coming into the system for juvenile justice. I think that people are just looking for ways to get kids served. And as I tell people all the time, criminalizing a kid is not the best way to get somebody served. We should have services in place like Mr. Duncan was talking about earlier, as far as making sure that we can prevent those kids from getting deeper into the system to begin with. Next slide. So mental health is one of the big areas that we're seeing as kids are coming into the system, into the juvenile justice system. The overall percentage of kids coming into the system now that need mental health care is up to 36%. As far as looking at kids that have substance abuse problems, that's 35%. Co-occurring mental health diagnosis with that substance abuse issue, that's 15% of the kids that are coming into the system right now. So we're seeing continued needs from these young people, and it speaks to the need for why we need the resources in our schools to help those young people. The social workers, the counselors, the people that can work with these young people to help divert them from those areas. Next slide. And I'd be remiss just in my role as deputy secretary to talk about, just like Karen was talking about, she's having trouble finding some talent. Well, we are having trouble finding talent too. I know we're having trouble finding teachers. We're having trouble finding social workers. We're having trouble finding people that want to do the work that Karen was describing. This shows you the overall vacancy rates in each of the different divisions of the Department of Public Safety. And I only bring this to your attention because I think what is really important as we move forward is that we need to invest in public service again. And it's across the board for our teachers, for our counselors, our social workers, our psychologists, the people that work with these young people. We need to value them. We need to make sure that they have the living wage that they need to take care of their own families. And so you can see the data here. I'm over juvenile justice. Unfortunately, we're at the bottom of that heap there at 39%. Of our total workforce is currently vacant, 39%. You compare that to the numbers I was just showing you, where we've had an uptick in juvenile crime of almost 21%. Their caseloads are through the roof, and our capacity in our facilities are through the roof. And we have fewer and fewer staff to work with those young people. And it's going to take an investment in our workforce if we want to attract good people to be able to do these jobs. And it's true with all the agencies. You can see up there, Highway Patrol, ALE, all these agencies are understaffed, but it's definitely true. And we're seeing that with our caring folks the most, the positions where we need people to take care of our young people and help out. The next slide real quick. This shows you the actual vacancy rates for juvenile justice. And so you can see all of these have trended in an uptick as far as the number of positions, but so the red line up there is our youth counselors. That's our baseline person that works in a facility in juvenile justice. And you can see that, we're up near 70% vacancy rates in those areas. It makes it extremely difficult to change a child's life if you don't have the people there to change that child's life. And so just wanted to point that out. And the last slide shows you what we're talking about as far as facilities. Again, we're seeing that white line in the middle there shows you where that would be that we're at capacity. So once we drop below that line, means we're over capacity in juvenile justice in our facilities. And so ever since January 3rd of this year, we have been over capacity in our juvenile justice facilities. Right this morning on our daily report, we were 78 kids over capacity. What does that mean? That's 78 kids that are sleeping on the floor. because they don't have a bed to sleep in, because we don't have the capacity to handle them. I bring this to your attention and you're thinking, what's this got to do with the school safety task force? Well, guess where these kids are coming from?
Yeah.
Where are they coming from and where should we have served them before they got to the point that they needed to end up in a juvenile justice facility? That need is shooting up because there's an underserved population that's currently out there in our schools and in our communities that we've got to find a way to find the resources to address those kids. And so that's through Medicaid expansion, that's through higher salaries for employees, that's for more resources in our communities to address this population. And so as a task force, I hope that we can come together and really think through what are some of the solutions, the long-term solutions to make this not become a trend line, but to make this just a blip on the radar that happened because of COVID, that we can get over and find the workforce and find the resources that we need for these young people to be successful. I'll be glad to take questions on any of those slides.
I have a quick question. On slide 8, you mentioned that 36% were identified, that are in the programming now were identified with mental health diagnosis. And you also mentioned like the complaints that you were getting, like a large percentage of complaints. How many of those complaints, if you know, like how many of those complaints also were with the mental, possibly could have been identified as mental health as well?
Yes, so what we do is when a kid, so when law enforcement files a complaint on a juvenile, which is what is basically arresting an adult would be called, we call it filing a complaint in the juvenile justice system. When that kid comes in, we do a full assessment on that child. And we do what's called the YASI, which is the Youth Assessment and Screening Inventory. And one of those areas that we look at is mental health needs. And so what this statistic means is of all the kids that came into the juvenile justice system last year, 36% of them had a mental health diagnosis into the system. 35% of them had a substance abuse disorder coming into the system. Now, that's on the front end of the system. By the time they get to the back end of the system, last year in our youth development center, which is where kids stay long-term in a facility, 100% of those kids had a mental health diagnosis, every single one of them. The average kid had 5 or more mental health diagnoses, 5 or more, all right? And on average, those kids that ended up in the deep end of the system were 5 years behind in reading and 4 years behind in math. What does that all tell you? I mean, this is a kid that we as a society failed to provide them the services that they needed to make sure that they could be successful. If they're that far, I mean, because the average kids coming in, they're supposed to be on 9th grade. If they're 5 grades behind, that means they're on a 4th grade level, y'all, for reading. And so it is their stark statistics, and it's a call to action, I think, for everybody that works in our public education system to figure out how do we serve these kids that we're currently not reaching.
Secretary Lassiter, one of the things I noticed in the 30-something years of being in the school system, when you have a student who present issues, just to send them to the alternative school doesn't change anything. What are you doing to help that child before you send them there? Because when they go there, by the time they get 16, they're gonna drop out. But have you addressed the mental health issues? Have you addressed the substance abuse issues? So you still got a statistic on your hands. So the goal is to do what you can to help them as early as possible, so you can reduce those chances.
And to add on to what you were just saying, it makes me think also about some of the things you mentioned in slide 4 around the crime prevention. And I'm thinking about, when we're thinking about prevention, I also think about in what ways are we having restoration too? Like, you know, because sometimes a service is not necessarily always restoration and building of trust. Like, you gave me this thing, but I still don't trust you. And so like, in what ways are we also, whether it be in school and outside of in our communities, in what ways are we fostering restoration and true community? Because true community means like we gonna lift each other up. Like, I'm okay, but I notice that someone else is not okay. So how are we also doing that in this work?
Yeah, so, and I know that in juvenile justice, we do restorative justice circles in each of our facilities.
Yes.
with the kids and the staff. And I can tell you that a lot of Wake County schools I know are doing now restorative justice circles. But that is the difference that it makes in the climate at the facility, because the kids are starting to see the staff that work with them have real issues too. There's things going on in their lives, and maybe the grace and the patience they weren't given them before, they start to give them. And it really does change the dynamic of how things occur in a classroom or in a facility or where you're doing it in a community. I 100%.
So just imagine if it wasn't just in the facility
Yeah.
after the fact.
Yeah.
Imagine if that was a part of the norm and the core, like we call it the core instruction.
Yeah.
Like that was the core of like, I think about the 50 behavioral specialists, it was like 73 behavior specialists needed. Like imagine if those people were already in spaces, which we already talked about, around the center, so.
Well, when Dr. Farrelly mentioned about the codes, what she was saying to you, in Power Schools, there are codes that you can check off on to say, if you referred them for mental health, if you did a suicide assessment, there are a lot of codes in there that can show actually what you've done.
Right.
So that's what she was talking about in
Yeah.
terms of the codes. They're in Power Schools,
Yeah.
if you choose to use them.
That's correct.
Or choose to allow the teachers to see them too. So there's that. Like, we have access.
I do have a couple of questions. Thanks for the presentation, very thorough, Chair
Okay.
Lester. One thing that perked me up when I heard you say you're doing it is going out to the community to offer the free gun box as a solution for parents who may not have access to it or just may not understand the importance of it. Does that include going to already established events that are in these communities? As a parent, I know that one more event to add to my calendar can
Right.
just, you might as well just cancel it.
Yeah.
But I know that there's some communities that they're already established sort of back to school initiatives or back to school fairs with trusted community partners and just latching on to the trust that's already been built in those circles and asked to be invited to those events as opposed to creating a separate event, which is encouraging too, because as you continue those year after year, then the trust is established. But I'm just wondering, does that include initiatives like that with what you're doing already?
We've gotten quite a few requests from those already established events to come out and do the NC Safe tabling and all. And so we are doing those events, and I know our new director of Office of Violence Prevention is trying to get to many of those events also. And so, yes, our goal is to try to reach out to already established connections. And one of the things that we are doing differently is in the past, normally these gun locks just went to law enforcement agencies. Now we're giving them to public health agencies also, to DSS offices, to really try to get where parents may be coming, where they may have a trusted relationship already in the community.
Absolutely. Thank you for that. That's good to know. Another question that I had surrounding the serious gaps that are in the services arena, specifically what you mentioned about our kids sleeping on DSS offices like that. I heard about that on the news and I was just floored to hear that. But I also have a friend who's on the other end who's trying to be a foster parent. And he expressed to me how hard it has been to get through that process. And so I wonder, where is the cog in the wheel? Where are the improvements in that process? I imagine it could be a personnel issue where there's just not enough people to get folks through those cycles of being approved, because we know those things are important. You gotta do your due diligence and your background checks and all the things. But some of the things he was sharing with me was quite puzzling as far as the questions that are asked, or the delay in getting back to him once he responds to your 100 questions about things that he felt like were so insignificant. So I just wonder, is it worth evaluating, where's the cog in the
Right,
wheel?
right.
Where are we why aren't people getting through that system quicker? And what can be done to remediate that?
And I'm glad she mentioned that, because there are a lot of people in the community who are of an older age that have raised children, that know how to take care of them, but there's that course that you have to take, where you have to go a couple of nights a week, maybe 8 to 12 weeks. maybe these people can't read or pass that course, but they would make excellent foster parents,
Yeah.
better than some of those that are getting paid. I've seen it, and I think a lot of that deters people from, applying for foster care because they cannot pass that course, but yet they do have the capacity and the skills to know how to take care of children. And I think that's one of the things I've heard, so I'm glad you mentioned that.
Absolutely, because that should not be happening, and I do believe we have a little bit of due diligence to figure out, where on our end is that being held up.
Absolutely.
And then the last comment or question, was the question, what can we as a task force do to help promote some of these job openings, to fill some of these vacancies? Because that is absurd, and I understand we're experiencing this across the country, and it's not just specific to this arena here, but what can we do to help promote the fact that there are some vacancies that need to be filled that affect our youth? And what that trickles down into is it affects our community, because when they're not served, then you have continued problems in the community. So what can we do to help with that?
I think that's a great question, because I think it's true with schools also, and with, because I think the stat that I saw yesterday was 2,500 teachers short statewide, and that may be underestimation.
It's a little under, yeah, it's a little under, I think. Yeah.
Well,
I think we have to, just two things. One, we have to raise salaries, both in law enforcement and juvenile justice, and that area, we need to raise salaries in the education. And we need to, and if you compare, just take what you can make with a bachelor's degree coming out of school, not even going to 5 years out, but just coming out of school, what you can make with a bachelor's degree compared to what you will make in education or law enforcement with a bachelor's degree in your starting position, there is a significant gap right off the bat. And so that needs to, never mind the fact that the scale after that does not suggest that you will have a meteoric rise in income thereafter. So that's one thing, but the other thing that we can do every single day that we need to do is to promote the level of professionalism and respect that these people should be accorded. And that has diminished very dramatically over the last couple of decades in ways that are disserving the people who serve in these positions, many of whom we should kiss their feet for what they're doing, and instead we bang over their head. We just need to change the way we think about the professional respect that should be accorded to people who hold these positions. They have our youth in their hands. The most important thing that we have is our youth, and yet we don't accord them the level of respect that they should be given on a daily basis. And I think we cannot say that enough about both of those items.
And I know we have to move on. I just want to say quickly, I've heard teachers already say they're tired of doing our jobs. They can't just go in and do the job that they're hired to do, teach. They have to do social skills. They have to do social work. They have to do counseling, because they're not always able to reach, because you got one counselor for 600 or 700 kids, one social worker that serves 2 or 3 different schools. So that's the other thing that I hear. They're tired of having to do jobs that they're not trained to do, if that makes any sense.
And it's hard to be a hero if you don't have the proper tools too. It's hard to do, I love what you said about public service. It's hard to do public service when you're not given the tools that you need in order to do it well.
Maybe what we can do, because I know we got to move on, because we got 2 guests online that are getting ready to present, but maybe we can look at a resolution that the task force can support at the next meeting. If you guys have some language to that effect of some things that I know that you brought up, Arnie, about the social workers and getting back to ratios. I know that we put that in a report that we did a couple of years back, but maybe it's time to reemphasize that before the short session of the legislature starts next session, to go ahead and say that these are things that we think are priorities that come out from the task force. So if y'all have got some suggestions on some language on that, feel free to send that to me and Aaron, and we'll work on a resolution that the task force can pass at the next meeting on some of those issues. All right, so I know we're behind on schedule, and I've got several people online that are getting ready to present. The first one is Kendall Tatar, and she's from the Attorney General's office. She's representing the AG's office today. and wants to talk to us about a couple of the seminars that they're going to be doing across the state to raise awareness about safety in our communities with our young people also. So Kendall, I'll turn it over to you.
That's great. Thank you very much. And first of all, can everyone hear me? Is that coming through all right?
We hear you.
Perfect. Okay, so good morning to all. Just to say, really appreciate the presentation so far this morning and all the support for our teachers and other public service workers. So just would be remiss not to mention that. Again, my name is Kendall Datar. I'm with the North Carolina Department of Justice. Apologies that I cannot be in person today. Look forward to getting back next time, but appreciate the time to give y'all a brief update. And I will be brief about some webinar series that DOJ is putting together that we would appreciate your thoughts and your help in sharing. So no surprise here, this is a group that knows it well, but a lot going on with our kids, particularly around safe gun storage. I know Deputy Secretary Lassiter just spoke to that. The Attorney General hosted an event back in May in Charlotte that touched on a couple of things related to youth safety and well-being. And one of the issues that came up there was safe gun storage. Particularly, we heard from a father whose son tried to access a gun in their home during a time where he was in a mental health crisis. Thankfully, was unable to access that gun because it was safely stored. And his son's inability to access that gun in that moment of crisis allowed the time that was needed for the son to come to his parents, look for help, and then for the parents to get him help. And pleased to share that that son is doing well these days. So one of the feedback, biggest pieces of feedback that we heard from that series that we hosted back in May was from parents really who said, this is great information. We would love an opportunity to more broad with parents, I think grandparents, caregivers, and others who work with kids across North Carolina. And so that is really where we had the genesis virtual series that we're starting in October. We're going to have 4 scheduled. They are designed, I heard a mention earlier, parents overbooked. Certainly that resonates with me. So we're trying to keep them short and again, available to join online. 30 to 45 minutes that will touch on specific topics, including online crimes against kids, youth substance use, mental health, and social media. And then first is safe gun storage. And that is going to be October 4th. So coming up here now, you'll see the invitation listed here. I'm very pleased to share that Deputy Secretary Lassiter is going to join to talk about the reasons behind the NC Safe campaign and what is going on with that campaign. So happy to have that. We will also have NCPTA President Dr. Shanika Moore-Lawrence to kick it off. We'll also have Raleigh Police Lieutenant Billy Garton, who will be on there to actually demonstrate safe storage and talk about what that looks like for folks who are able to join. The Attorney General will be there. Also, that father that I mentioned will join as well to provide sort of a firsthand perspective about the importance of safe gun storage. He has become a really passionate advocate for this topic. And so wanted to update on the work that we have on there, and also would really appreciate your help if you're willing in sharing this information. Our goal here is to share it very broadly. And so we've done a lot of outreach already, to schools, to DSS, to public health departments, to youth organizations like Boys and Girls Clubs, PTAs, PTOs. But we're really trying to break through. I think there are so many folks who certainly folks in this room, we get invitations to webinars or things like that, but trying to get to the group of folks who maybe don't run into that as much in their day-to-day. We're hopeful that these webinars can provide some sort of high-level basic education about important topics, and then also some resources that folks can use that are free and available to them as they go on in their work with kids. So again, wanted to update all on our plans here. Would really appreciate your help in sharing this. This is Erin has kindly put up the invitation here. Happy to share the website that has the registration open live. And certainly if you have thoughts about that, I know we're tight on time, but happy to follow up with my email. Would welcome all suggestions on that front.
Kendall, we appreciate it, and we'll send this out to all the task force members so that they can help distribute it. And please feel free to send it to any of your school folks that may be interested in attending the seminars. And if anybody have a quick question for Kendall? I know we're behind on the agenda, so.
And she did say they've already sent it out to districts and then PSUs and LEAs. Everyone has it.
Do you know, is that right?
That's correct. But I would say, I mean, we all well know you get how many thousands of emails in a day. So if you have a contact that you think is worth following up with, please let me know. We're very happy to do that.
Thanks, Kendall. We appreciate it. Thanks for joining.
Thank you.
So next up, we have Dr. Baker, who's with the UNC system. And I know she's going to talk to us about some of the supports that they're doing in the UNC system and kind of how we wanted to see how that's working and maybe can reflect on our K-12 population also. So thank you so much for being here, Dr. Baker, and we're really excited to hear about what you guys are up to at the UNC system.
We can't hear her.
Yeah, I think you're muted, or we got her muted.
Oh, she's.
Oh, there we go. I think we
Can
got
you hear me now?
Yep, we're good.
Yeah. Okay. All right. That's a move in the right direction. Amateur moment there for me. All right. Let me go ahead and get my presentation shared. I have 3 screens, so I apologize if I'm not looking at you. I'm looking at one of my 3 screens. All right. Let me go ahead and share this. Let's see. Okay. Can you see my presentation?
Yes.
Okay. All right. Well, thank you for inviting me to share about some of the behavioral health work that's taking place across the UNC system. My name is Susie Baker. I'm the Director of Student Affairs for the UNC system. In my role, I am responsible for working closely with our deans of students, our counseling center directors, our collegiate recovery community coordinators, but I'm also responsible for many of the system-wide behavioral health programs that are implemented at our campuses. And I work with our academic and student affairs team to make sure that we're being thoughtful and strategic in our approach to supporting student mental health. And I actually started my career in clinical mental health emergency assessment work before spending 5 years as a high school counselor and then moving into student care and critical incident response roles in post-secondary education at Virginia Tech, UNC Chapel Hill, and now at the UNC system. So student mental health and safety has long since been the lighthouse of my career, and I'm glad to connect with others for whom this is a priority. So thank you for having me. So why does the UNC system have such a strong focus on student mental health? I will try and offer a very brief background. In September 2020, the UNC system president, Peter Hans, was tasked by our Board of Governors to convene experts across the system to evaluate the status of student mental health services and then come up with a set of recommendations for the board to consider. And the board identified 3 main questions to guide this work. That focused on the appropriate level of mental health service within the UNC system institutions that they should be providing, and if that's being accomplished, if funding is sufficient, and what other revenue models could be considered, and what best practices should institutions be adopting to improve the delivery of student mental health services. And through their work to answer these questions, the task force identified these 3 main buckets of issues that affect student mental health and delivery of services to support them at the campus level. And those were that there is increased demand for mental health services, strained capacity on mental health providers, and there's limited ongoing funding. So subsequently, the task force authored this document called the Healthy Minds, Strong Universities Report, which was released in May 2021. And from the report, there was a series of 8 overarching recommendations that were made from 3 working groups that were focused on measurements and outcomes, promising practices and innovations, and finance. And at the same time, President Hans secured $5 million from the Governor's Emergency Education Relief Fund so that we could immediately begin implementing these recommendations that were provided in the report. And then by way of follow-up in March 2023, the system was awarded another $7.7 million from the same GEAR funds to continue this work and to extend our ongoing efforts and introduce new initiatives. So over the last 2 years, the UNC system has rolled out 17 initiatives, some system-wide and some that are targeted at specific institutions. So with September being National Suicide Prevention Month, the focus and this group's focus being on student safety, it seemed like the most sensible thing for us to focus on in our short time together is how, as a system, we're responding to suicidality and how we're helping students develop healthy coping skills and build resilience to lead mentally healthier lives. So as we know, nationally, suicide is the second leading cause of death among 15 to 24-year-olds. And in North Carolina specifically, suicide is the third leading cause of death among 10 to 24-year-olds. So for this presentation, we're going to focus on those programs that equip faculty, staff, and students with the skills they need to intervene and respond to individuals that are experiencing suicidal thoughts and behaviors, as well as the programs that foster greater resilience through engaging with educational and prevention skill building efforts, and then end with those that create lasting systemic cultural change. So we'll just be touching on 3 of our 17 initiatives today: QPR, mental health first aid, and JED. Please pardon my rudimentary PowerPoint skills with this continuum, but as we know, mental health is impacted and intersects with all of life's realities that can make positive, healthy, and resilient students' lives easier or contribute to us being less able to deal with life stresses or even have a really severe negative impact on mental wellness. And students experience each end of this continuum and everything in between while they're with us. So a holistic approach to addressing students' evolving needs for mental health care is seen by our system as essential. So you can see on the left-hand side of this continuum a list of some protective factors, and it's certainly not an all-inclusive list, but these help students achieve and maintain positive, healthy, and resilient mental health. So what I'm going to call being in the green. And then these factors are things like being supported and fully connected, engaging in healthy living practices like exercise, good nutrition, having access to resources, developing problem-solving skills, and having a greater sense of self-awareness and being willing to seek help. And on the right-hand side, there are some risk factors listed, again, not an all-inclusive list. These are things that contribute to reduced resilience, increased stress, and if not mitigated, can certainly contribute to severe mental illness. And this is what I would call being in the red. So these are factors like being socially isolated, having very little support, being housing or food insecure, experiencing trauma, being a victim of harassment or bullying, cyberbullying, things like that. And so you can kind of see from the continuum that the midpoint gives us some clues about how these protective and risk factors show up in student mental health and the value of having resources in place that seek out protective factors and reduce risk factors. So we took both ends of this continuum and the concept of increasing protective factors and decreasing risk factors into account when we developed a strategic approach to fostering mentally healthier students. So we've adopted this wraparound approach to both providing intervention and response services to students who are in the red or approaching the red, as well as resilience building and prevention initiatives to give them the skills and resources to move from the yellow to the green and to stay there. So this little Venn diagram provides really just a snapshot of how this is being accomplished. And I do mean a snapshot because I ran out of room to include everything in these bubbles. But you'll see here on the left-hand side, the efforts that are aimed towards resilience and prevention, which include, among others, things like the Penn Resilience Program, some grants that focused on resilience, mental health, and well-being, our It Matters student well-being modules. And then on the right-hand side, we have our intervention and response efforts, which include our mental health crisis response line protocol, our shared telepsychiatry program, and our QPR training. And then in the middle, you'll see the efforts that really span both ends of this spectrum. So these includes programs like JED Campus, our case management expansion initiative, and guide training. And as I mentioned at the start of the presentation, between May 2021 and today, we have 17 behavioral health programs and initiatives that are active throughout institutions in the UNC system. And we've also been able to partner with the North Carolina Community College System and the North Carolina Independent Colleges and Universities. So our reach has been extended further throughout the state. And if I tried to talk to you about all 17, we would be here all day, so I tried to focus on those that most closely align with student safety and that have clear K through 12 options and applications. But I'm happy to answer questions or do follow-up about any of the other programs that you might be interested in and get answers for you if I don't know them offhand. So I'll start with mental health first aid. $1 million of our gear funding was dedicated solely to roll out mental health first aid. So this was a partnership with our independent colleges and universities and the community college system, but it was led by the UNC system. If you're not familiar with it, mental health first aid is a program that teaches folks to identify, understand, and respond to signs of mental illness and substance abuse disorders and guide those in need of help to get appropriate care. And as a system, we implemented this in a two-phase process. So phase one was to train instructors to be able to deliver mental health first aid courses. And as you can see, we have more than 350 trained instructors throughout the UNC system, the community college system, and the independent and private colleges and universities. And phase two was to have those trained instructors offer courses that would train people to become mental health first aiders. This was a model in sustainability and project scaling for sure. So more than 300 courses have been offered. And as a result, there are now more than 5,000 people trained as mental health first aiders in our post-secondary institutions statewide. Excuse me. Now, while we focused on adults, there are two other mental health first aid programs that may be more beneficial for K through 12 systems. So youth mental health first aid is the most closely aligned to what we did, a similar program, but youth mental health first aid trains parents, family members, community members, teachers, school staff, how to help adolescents specifically, those that are 12 through 18. And teen mental health first aid is actually designed to train sophomores, juniors, and seniors to respond to their friends and peers. And these programs have a more broad focus on mental health crisis and substance abuse issues, including but not limited to how to address suicidality. Then we have our QPR program. So a National Suicide Prevention Program. QPR stands for Question, Persuade, and Refer. And it's an emergency mental health intervention that's designed to train participants to identify and intervene if someone is suicidal. And the training gives participants strategies and skills to reach out and provide initial help and support to somebody who might be developing a mental health or substance abuse problem or experiencing a crisis and is suicidal. And so this program is newer for us. We just started this in the summer, but this has been made available to train students, faculty, and staff from all 116 higher education institutions in North Carolina. And so far, we've really seen tremendous interest in this opportunity. So the requests for funding to participate in QPR from those three organizations totaled over $800,000, which was way more than we had budgeted for this project. And we ultimately were able to award 59 grants for just over 400,000, but clearly the interest level and need exceeded what we anticipated. So we then needed to try and figure out a way to expand that. But the impact of this particular project is really significant. So from just the 59 grants that we awarded, there are going to be 612 QPR instructors that can then train others on QPR, which will ultimately result in more than 20,000 QPR trained gatekeepers before the end of the academic year. We were lucky to get an extra $600,000 from the governor's office that was redirected from funds that were unspent, that had been given to other agencies. And that meant that we were able to offer this summer summit instructor training that trained an additional 142 faculty and staff. So at this point, we've got enormous potential for QPR to be very far-reaching across the state. And just to sort of clarify, QPR is on that intervention and response end of our holistic approach. So it's designed to address student needs when they are in the red or heading to the red from the yellow, so we can keep them safe and move them back into the green. QPR also has specialized training opportunities for the application of QPR in environments that serve youth and young adults. And similar to mental health first aid, they offer an affordable train the trainer certification course so that staff can become trained to teach QPR to teachers, staff, and students at their schools and really across the district. So this is really a very cost-effective way of training a large number of folks in QPR and would work really well as an in-service project, given that QPR training, not the train the trainer, but the actual QPR gatekeeper training, takes only about 60 to 90 minutes to administer. And then finally, spanning both ends of our continuum and everything in between is the JED Campus Program. Excuse me. JED is a nonprofit organization that looks to strengthen mental health and prevent suicide among young adults. JED Campus at the post-secondary level is a 4-year program that helps schools implement comprehensive positive systemic change in the campus community. And it focuses on developing life skills, resilience, promoting social connectedness, identifying students that are at risk, and increasing and norming help-seeking behaviors. So we have a strategic plan goal in the UNC system of improving student mental health. And for us, JED directly aligns with that strategic plan goal. One of the metrics for which is instituting the Healthy Mind Study, which is a post-secondary study, to get a good sense of what the strengths and opportunities are at each of our campuses with regards to the status of student mental health and the associated resources. We currently have 2 JED campus alums in our system, which are the UNC School of the Arts and Appalachian State, and UNC Chapel Hill is on year 2 of the 4-year program. When we instituted this, we got an additional 10 institutions that will be starting the JED campus. Actually, they just started in August. So by the end of 2027, we will almost have a full system of JED campuses, and that's certainly the goal. So just for a little bit of context about the impact of JED, JED evaluated 56 schools who completed the JED campus program between 2014 and 20 to come up with this sort of campus impact report. And while they've got lots and lots of metrics, I just wanted to focus on 2, given the short amount of time I have today. The first is their impact on developing life skills, which I think is very critical both at the K through 12 and post-secondary level. And it's certainly a big goal for us at our institutions. So after completing the JED campus, 91% of the participating campuses had instituted campaigns or programs that educate students about the link between good physical health, mental health, and academic success. And just one really quick and simple example of this, one of our JED alums, Appalachian State, integrated mental health questions into their student health information form, just encouraging students to see mental health as part of their overall well-being. Simple, but effective. And then the second is JED's impact on increasing help-seeking behaviors. So one of the important protective factors for our students is being self-aware and willing to look for help when it's needed. So after completing the JED campus, 87% of our participating campuses had instituted campaigns and or programs that work to destigmatize mental health and inform students about campus resources for mental health support. So this is a really powerful program. And like I said, we're really hopeful that our entire system will be JED campus certified by the end of 2027. But JED also has a high school specific program that is 36 months. It's a technical assistance program that helps high schools and school districts assess their existing prevention and promotion efforts and strengthen them, as well as look at their intervention and response efforts. And their program aims to improve student mental health. It aims to improve graduate rates and school culture while decreasing absentee rates and substance abuse and misuse. And so while the Healthy Mind Study isn't IRB approved for K through 12, JED has developed their own alternative baseline assessments that look at sort of the school level. There's a student survey, there's a staff and faculty assessment, all of which, when you bring it together, provides this comprehensive report about the strengths and opportunities, and then tangibly measures the progress and efficacy of interventions that are introduced throughout the life of their technical assistance program. They also do have some funding support to help schools implement this program if financial barriers present issues to doing the JED high school program. And then I will say that something that is very fundamental to our work and how we view improving student mental health is the core understanding that mental health is the work of everybody. So it doesn't solely belong in our counseling centers. In fact, only about 10% of the student population actually seeks services from our counseling centers. So as we thought about the best way to have an impact, we considered where the touch points are for students, and they really are everywhere. So they're in the classrooms they learn in, they're in the residence halls they live in, they're in the dining rooms they eat in, they're in the offices they visit to take care of their registration, their bills, to get academic coaching, the gyms they work out in. They're everywhere. So we made it our mission to create opportunities for everyone in those spaces to get some level of training, to have meaningful conversations with students who may be anywhere on that mental health continuum. And folks in any role on our campuses and student peers should be equipped to identify and support student mental health needs and meet them where they are. And that doesn't mean that everybody needs to be referred to our counseling centers, but rather that we need to have resources that address student needs along that continuum, and that we're educated and prepared as community members to guide them as such. So we keep that notion at the forefront as we think about how best to accomplish this work. And I think I'm probably out of time. I know we're a little bit behind, but if there are questions, I would be glad to field them if I can.
I had a question really quickly. My name is Donovan Bethea. I was curious as to the 13 institutions that you were saying in the beginning were served, directly serving the mental health initiatives.
I'm sorry, I couldn't
Yeah,
hear you
no.
very well. Would you mind repeating that question?
Yeah.
Sorry. Oh, okay.
You want me to- or you-
Oh, you can, yes, sir.
So he was asking about the 13 institutions that have already implemented the process.
Like which ones they are?
Is that,
Yes.
did I get it right?
Okay, so we have,
Yes.
it's actually probably easier to identify which ones are not. So we already have a JED alum. So being a JED alum means that you've completed the 4-year program. So our UNC School of the Arts and Appalachian State have both completed the JED campus program. And then UNC Chapel Hill is in year 2 of the JED campus program. Then we have 10 other post-secondary institutions. So the ones that are not participating in the August cohort. So JED has 2 cohorts. They start in August and they start in February. And our 10 institutions that started in August are all but North Carolina School of Science and Math, because they are K through 12. They actually were contemplating doing the high school program. But JED does require a pan institution task force. And so there is a level of human resource commitment that needs to be made. And School of Science and Math was just not able to make that commitment at this time. UNCG, I believe, is one of our campuses that was not able to provide that level of commitment for an August cohort, but I am chasing them for a February cohort. And then I'm trying to think of our other ones. There was one other one that couldn't do it. I'll have to come back to you on it. It's escaped my
A&T, right?
escaped me. But
So he goes to A&T. Does A&T do it?
A&T is on our list. Yes. Let me see. I actually have a whole matrix of. Do I have it up on my screen? Probably. I'm definitely a person that has at least 800 tabs open at the same time, and we have a full matrix that details all of the different initiatives that are at all of our institutions. I just did that the other day. Let me see, and I will tell you exactly. Okay, so JED. In fact, let me go ahead. If I can actually share this with you, and so you can kind of get a glance at what is where. Let me go back and put this over here. Stop sharing. Okay. Here is our big matrix. Let me share this with you. Excuse me. Okay. You should be able to see a really ugly matrix on the screen. It's not attractive, but it serves the purpose. So this gives you a sense of all of the different initiatives that we currently have. So 17 of them. And if you look over here in our our JED campus program, all of our institutions are listed left to right in alphabetical order. So ECU is one that did not participate. A&T did not participate, and UNCG did not participate, and School of Science and Math did not participate. And the only reason they did not is because they simply did not have the human resources to be able to navigate that size task force at this particular time. But our intention is to be able to fund those schools when they are ready to be able to execute the JED campus. So we are close for it to be a whole system. We're getting there. We'll get there. Does that answer your question?
Yes, it did. And then in addition to that, do you know, just in reaction to some of the things that happen on campus, I know on the topic of mental health especially, what are we doing to like provide students resources that are more so reactionary when they go through these catastrophic events?
Yeah, such a great question. So I'll go back to let's see if I can go back to my little slide here. So like I said, we have built out a system where we have sort of prevention services and then intervention services. And actually with our first 5 million, what we really focused on was response, simply because it was necessary. We were amid the pandemic, and it really needed to be something that could address student needs immediately. So if you look at kind of this right-hand bubble, the intervention and response, the things that exist in that right-hand bubble of a more immediate crisis response. So protocol is our crisis response phone line. That's actually in every single one of our institutions. So it provides 24/7 access for students to get counseling services at every single one of our institutions. And we've had that in place since 2020, and we have a continuing contract with them through the end of 2025. So that's one way. Our neuropsych relationship, we have a tele-psychiatry shared pilot program for I think 8 of our schools to provide access for folks who don't have access to psychiatry services is another way that we do that. And so neuropsych is able to provide services to students within 10 days of referral, which is much faster than being referred out to any other psychiatry services in the community. Excuse me. Our off-campus mental health referral microgrants are also immediate support services for students to get mental health care outside of the institution. So one of the noted issues in our Healthy Minds Strong Universities report was that when there's an increase in student mental health needs, there isn't necessarily a correlated increase in student mental health providers that can attend to those needs. And so college counseling centers, much in the same way that K through 12 school counselors are not designed to provide in-depth, ongoing therapeutic care, especially in specialized areas. They are meant to triage, provide immediate response care needs, and then support referral out into the community to encourage students to connect with long-term care. We were facing financial barriers for students in doing that. And so we introduced our mental health referral microgrants so that we could fund students to get ongoing long-term therapeutic care. The other thing that we're currently looking at that we're looking to fund with the latest amount, the latest 7.7 million, is surge capacity services. So again, we are going to continue to see critical incidents on our campuses in the same way that you see them in K through 12 schools. And whenever we do, we see a surge in mental health needs. So while protocol exists for crisis response by phone, we also want to be able to provide therapeutic services immediately, and our counseling centers cannot just scale up at the drop of a hat to be able to do that. So we're actually looking at introducing surge capacity services that can be applied at any of our institutions immediately, so that students will have access to therapy therapy appointments on the same day. So that one's still in the hopper. It's still being worked on, but that's one of the other ways that we're working with it. In the past, without that, what we have done is all of our institutions have, I work with the counseling center directors, so we have collectively come together to help support whichever institution needs the surge support. So last year, NC State and A&T needed surge capacity support, and several of our schools were able to essentially loan out some of their staff or provide teletherapy services to state and A&T students for the period of time that it was needed. So we are doing whatever we can whenever we need to, based on the responses that are necessary.
We're almost out of time. Does anybody have one more quick question or?
Well, one of the things that you mentioned was that you were, that the students are everywhere. And so that you are really making sure that they're trained in the gym and everywhere else. How are some of the programs leveraging student organizations, like the clubs and/or other activities that students are involved in? Are they leveraging any of those as well?
Yeah, absolutely, absolutely. So all of our QPR, our mental health first aid, all of those programs are being offered to students, faculty, and staff. And so student organizations have included these courses as part of their in-service or required them for their leadership. Our student government folks have employed mental health first aid courses in their organizations. So it's certainly being found out through the student body. The other interest that we've seen is peer support. So there's a very large movement towards peer support. Like I said, this little Venn diagram does not include everything because I simply couldn't get it all in there, but there has certainly been a big movement towards peer support efforts. And so we have some of our resilience grants focus on peer support at different institutions and modeling and scaling up what peer support looks like. And the provision of these trainings is available to all of those student-led organizations as well. So students are really on board with getting connected with these different trainings and being able to be equipped with the knowledge to allow them to respond to peers. But we are seeing a significant uptick in organizations and leaders of organizations that are student-led pursuing these trainings.
Thank you so much, Dr. Baker. I wish we had more time because I think we have more questions, but we got one more thing on the agenda we got to get in, and so we really appreciate you joining us today. I think a lot of the lessons learned that you guys have gotten in from the university system are things we can bring back to the K-12 environment and figure out how we can provide those services. So thank you so much for being here today, and we'll share your PowerPoint with the folks that are here today. Thank you.
Thank you for the time. I appreciate it. Take care.
All right, I know we're getting late in the hour here, but if y'all can hang with us for just a couple more minutes here, I'm gonna have Elizabeth come up and give us an update on the state action plan. And is Dawson gonna present with you?
Yes, I'm gonna just give real quick background, and then Dawson's actually gonna do most of the presentation. So most of you all know, but the state action plan is a 5-year plan of actions that state agencies can take to support school safety. The plan was developed by the task force and endorsed by the task force back in 2021. Since that time, our team at DPS has been collecting status updates from the different government agencies on implementation. And as we were doing this, received a lot of feedback that there were certain changes that needed to be made, things that needed to be revised, removed. Since it's been a couple years since it was implemented, we this summer reached out to all of you for feedback to see, now that we're 2 years in, what changes are needed to the plan. Most of the edits we received came directly from those state agencies that own these initiatives, though we did get some feedback from a couple other task force members too. So thank you all for taking a look and giving us feedback. And after we present these to you today, our team will go ahead and make those updates to the plan itself, which is a public-facing document. So we'll send that out to all of you, and it's on the DPS website. With that, I'm going to turn it over to Dawson Spencer from my team, who's going to walk us through the feedback that we received.
I think it's like slide 3, I'm thinking. Yeah. Thank you so much. Yeah. Yes, revise. Thank you so much. I understand sitting between you and your lunch, so I'll be profound, but also profoundly brief. So the revised initiatives, the revisions are from actually all from DHHS. They are updating language post-COVID pandemic, and they are updating their language to be most of their field languages that they use in their profession. That is everything that you see in the bullet points above you. I realize it's very text heavy, but details matter in this plan, so I want to make sure you had that with you when you look at it. But these are all just revisions post-COVID and updating language within their field. That's what the revisions are for, and they came from the owner of the initiative. So this is the first of 3 slides for completed initiatives. There are 14 completed initiatives since 2021. We'll make the initiatives marked as completed in the next public document, assuming this is approved by the task force. We will continue with adding it on the document, but we will not ask for any updates from the owners of the initiatives any longer. So we'll make sure that we know we've completed them, but we're not asked for DHS or DOJ to give updates on them any longer, as they are considered complete by the owners. So this is the first slide. That is the second. And we'll give a note for the third. You can kind of like embrace what you're reading. It's a lot. But yes, which is good news. That means there are 14 initiatives have been completed in totality. So that's good, a good problem to have. New initiatives. The first one is a new initiative to provide funding and support for training school workforce and youth mental health first aid. It is proposed by DHHS for goal number 1. The second goal was proposed by Sheriff Rogers of Guilford County for goal 4, to conduct annual active shooter response tabletop exercises with key stakeholders, including law enforcement, emergency responders, and school staff. In the due diligence of our office, we did find that that is already required by law, something that you may want to know within your discussion. That does not mean it is not important, or it does not mean it lacks meaning within our initiatives. But I did want to mention that for those who did not know that was already in our state statutes. So there are a couple that are going to be removed when approved. The top 2 bullets are from DHHS. They are already covered in other initiatives that DHHS owns. And so they're somewhat duplicated, and they want to minimize duplication within the action plan. The next 2 are proposed by NCEM. They are also already covered not by initiatives, but by federal governing laws and or procedures by the government. So that is why they are being asked to be removed. They're already in progress throughout both divisions and departments. Next steps is to publish this document if approved by the task force. We'll also note that we are going to create a change if approved. We're going to move to annual status reports rather than quarterly reports that we're doing currently and have done that I'm aware of the entire time the action plan has existed. That is in line with other state strategies and other plans across the state, including DPS, DPI, and HHS. So we just want to make sure that we're giving more time for implementation for the owner of the initiatives in between the corners. That was profound and profoundly brief. Any questions?
I don't have a question, but I do want to point out that you did mention on the new initiative, the conducting the active shooter response tabletops. That is already mandated for the Center for Safer School and Senate Bill 105. So we are already required to do that. So just needed you to know.
Yes, ma'am. Thank you so
Not
much.
kind of a new initiative.
Yeah,
But
agreed.
not.
Yeah, it's not a new initiative
Right.
either from the state. I guess it's kind of just something that we'll be tracking if approved by the task force. But something that can be discussed before we approve. Thank you, ma'am.
And I'll add in, we don't necessarily have to add that to the plan. We just wanted to make sure we brought all the feedback we received to you all.
Yes, sir.
One very quick comment. I noticed one of the ones you said was completed from DPI, included in there was the youth risk behavior survey. And I have a little concern about that because there's at least some legislation out there to turn it into an opt-in instead of opt-out initiative, which could change very much whether or not you get sufficient numbers in order to have a valid survey. It's incredibly important information, and I hope that we can stay with opt-out and not opt-in, because it's close to the most valuable information we get from our youth about where they are. So I'm a little tentative about just taking that out and not keeping an eye on that.
I wanted to reiterate the same thing I was about to say. Is it still something that we're monitoring under a different initiative or?
So I don't know about that in particular. I do know some of the ones that are marked complete are also ongoing. So there's something that the initiative owners can do further to improve the initiative, but it is completed what they need to do, but it may be ongoing for the next year.
Under
That
that-
may be one of them.
Under that definition, I think that's the right place, but I think we should keep it on our radar screen.
Yes, sir.
The last comment about it then. Thank you.
Thank you.
Any other questions about the school safety action plan updates? So Dawson, can we just put, the ones that are completed, will they still show up on the plan? Is that how it
Yes.
works? Okay.
Yes, sir. Yeah, those will be on the plan.
We'll just mark to show that progress, that this is something the state's already done, or is doing, but we're not gonna take them out.
So maybe it's
We
going to
can
be,
clarify that if, for you, sir, and for others that is confusing because they completed, they're also some are ongoing, not just stopped and hit the deadline.
maybe we can create an ongoing category then.
Sure. Absolutely.
Any other questions from the feedback that we got? So all this is feedback. So what we did is we sent this out to all the partnering agencies to respond with updated tasks that they wanted to see in the action plan. And so this is the feedback that we got from DPI, DOJ, DHHS, DPS, and built into the plan. So if there's any concerns, let us know. If not, we will approve the plan unless someone has a ultimate concern about something. All right, everybody in favor of approving the plan, say aye. Aye. Anybody opposed? All right, sounds good. Thank you very much, Dawson and Elizabeth, and congratulations on your coming baby, Elizabeth, our future student. So any other new business before we wrap up the meeting for today? All right, well, thank y'all so much for attending today, and we appreciate all your feedback, and we will send out information about the next upcoming meeting. Thank you so much.